Welcome to RoyalPearlz High Yield Teaching Deck. Here we teach about high yield areas for ANCC exam or English exam. Today we are going to be talking about clozapine. Clozapine is one of the most testable antipsychotic for ANCC. It is the only medication approved for treatment-resistant schizophrenia and the only one proven to reduce suicidal behavior. So for your exams, you need to remember that clozapine equals treatment resistant, suicidality, and mandatory ANC or WBC monitoring. So when we talk about the indications, like I said earlier, clozapine is used for treatment-resistant schizophrenia, meaning the patient must have failed two adequate antipsychotic trials. It is also used to reduce suicidal behavior in patients suffering from schizophrenia or schizoaffective disorder. Let's talk about the black box warning. This is a high yield warning, agranulocytosis, which means life-threatening drop in ANC or WBC. We also have seizures, especially at doses above 600 milligrams daily, myocarditis, and cardiomyopathy. So, severe orthostatic hypotension. You know that most of the antipsychotic causes hypotension. Clozapine is one of them. Bradycardia and syncope. And also, clozapine have this increased risk for mortality in elderly patients with dementia or psychosis. So you have to be careful when using clozapine on elderly patients. The next thing we are talking about is the monitoring. Before you start any patient on clozapine, you need to obtain the baseline for ANC or WBC. Also, you need to enroll this patient in REMS program. So clozapine require REMS program. The monitoring schedule are 6 weeks, is weekly for 6 months, then 2 weeks, every 2 weeks for 6 months, then monthly if the patient is stable. So let's talk about the discontinuation rule. Remember to discontinue clozapine if ANC falls below 1000 or if WBC falls below 2500. This is one of the most testable numbers, so you need to remember these numbers. Also, if a patient complains about fever or sore throat, you need to suspect agranulocytosis. When we talk about the side effects, clozapine have unique exam favorite side effects. So these side effects you may likely see on your ANCC exam. So pay attention to severe constipation. That can be life-threatening. Also, we have nighttime drooling. That can also be so uncomfortable. Heavy sedation, weight gain with metabolic syndrome, and you know that second generation antipsychotic have this metabolic syndrome, and clozapine is one of them. These are also classic for ANCC exam, so remember this. When you talk about drug interaction, smoking is one of the things that induces clozapine. Smoking induces CYP1A2, lowering clozapine level. So if a patient stops smoking, clozapine level will increase and those must be reduced. So pay attention when your patient is smoking and when the patient stop smoking so that you can adjust the dosage of clozapine appropriately. Also, combining clozapine with benzodiazepines can increase the risk for respiratory depression and collapse. Pay attention to these points. Remember them for ANCC exams. So let's talk about the clinical course. Clozapine has the lowest EPS and tardive dyskinesia risk of all the antipsychotic. So overdoses can cause seizure arrhythmias, and CNS depression. Remember, clozapine is never the first line. It is only used after 2 failed antipsychotic trials and always require ANC or WBC monitoring. Remember. So if you see treatment-resistant schizophrenia, persistent suicidality, ANC or WBC monitoring, or REMS in a question stem, the answer is clozapine. Numbers to memorize: when you stop clozapine if ANC is less than 1,000 or if WBC is less than 2,500. Test favorite also include constipation and nighttime drooling. So ANCC likes safety-focused answers. Look for options about monitoring, stopping therapy for low ANC or WBC, and all patient education. Clozapine saves lives, but only if you know how to monitor and when to stop it. Memorize the numbers, like I said earlier, memorize the schedules, and you will be ready. Today we talked about clozapine. I have 10 more questions on my channel that covers all the possible high yield area on clozapine that you can possibly see on your ANCC. Check those out. Share this video, comment, like, subscribe to my channel so that you can know when I drop my videos. Share this with anybody that you know that is preparing for their exam, and follow me for